pessoal, bem-vindos ao ReMindCast. Eu sou a Bia.
E eu sou a Jaque.
E hoje a gente está aqui com o nosso querido, amado mestre, Dr. SHAH.
Hello, it's a pleasure to be here. I don't want to leave.
You don't want to leave?
No.
We are in São Paulo, in Brazil, and he came just to teach the course with us. How was the experience, Dr. J?
Amazing.
Really?
Wonderful. It's like being in heaven.
Wow.
I am flying. I am enjoying myself. The students asked great questions. The participant and everybody was enthusiastic, wanted to learn, right?
Yeah.
And the two of you taught so much, and we had such great discussions, interactions. For me, it was so exciting to see light bulbs going off in people's eyes, you know.
And you saw that, right?
I saw that. I saw
that too.
Yeah. And I am convinced that one of the reasons is because it was a very multidisciplinary audience. We had chiropractors, physios, and all kinds of medical doctors.
Yes.
And this is the way courses on pain should be taught to really enhance the discussion. So I am grateful to both of you for all the work you did to make it happen.
It's an honor for us to have you here and to teach with us. And when we talk about central sensitization, it's very hard concept to understand, to talk about it. And I think when we could, how can I say? Summarize, but when we could talk with them about this, the pets can...
And we can demonstrate it too.
Yes.
That's the other thing, I think, if I interrupt you for a second, like Pavel and Rael, for them experiencing it on their own body to have an examination. Now, it's not an abstract concept, central sensitization. It just means that your threshold is lower and that there are easy ways to test it and then easy ways to treat it.
And they can use this.
That's right, and you can use it in your clinic,
yes,
in your patient
I guess
treatments.
This makes the difference.
That makes all the difference.
Because you feel in yourself,
right,
because it's a problem that mostly everybody has.
Mostly, that's right.
These days.
Yeah.
For one thing or another, or sometime in your life, you're gonna experience this kind of pain,
right,
and who knows, develop a central sensitization, and now if you feel in yourself and you're able and you have how to treat your patients with more success.
Yes.
We gave them some tools.
We gave them multimodal tools.
Multimodal tools.
Yes.
As we said in the title. Yeah.
Yes.
And I guess this is too rich. This is too important for them to
keep going, spread the news.
Yeah.
Yes. And change the mind.
That's right. Change the way their perspective.
Yes.
It gives you a new filter through which to look at people.
At the first time, I guess, for everyone, for me and Bia, happened this way.
Yeah.
And we started to, oh my gosh, what we are going to do now?
Right.
We must have to change our way to think and then to put this in our clinic,
right,
and our day by day
practice,
our practice,
right.
And we work together, but we have 4 more professionals working with us, and when we started doing this, it caused some tension. What are they doing?
Yeah.
What is that thing?
Why they are doing this way? Why they are conducting?
Can I do that too? And we say, yes,
of course you can.
Just you have to learn and study.
That's right.
And make an effort to get out of your little box.
Right. Exactly.
And spread your knowledge.
Yes.
Dr. J, you teach all around the world, right? How do you see Brazilian professionals?
Well, first of all, there is tremendous eagerness and motivation to learn. That was so evident in the class here. People are hungry for information. They are desperate to help their patients in ways that do not rely on solely on drugs.
Only on drugs, yeah.
And I am very excited, and especially the physios, because the physios are the ones who are in the English we say in the trenches, which means the day-to-day grind of seeing patients with chronic pain, who sometimes come to physios after trying everything else. And by that time, sometimes they have so much pain and dysfunction, you can still help them, but you would have been able to help them much quicker, with much less effort and suffering on their part if they came to you sooner. So what I try to teach, what we are hopefully teaching together moving forward, is the importance of integrating this model into clinical practice. Because everything we taught about the science of chronic pain and how this influences assessment should be for everybody. Then the treatments that people can provide, depending upon their practice guidelines, and their profession.
Sure.
So clearly, a physician would be prescribing medications and might be doing injections, in addition to doing dry needling, electrical stimulation, etc.
We have to integrate.
Exactly, integrate.
Our knowledge.
Yeah,
now.
exactly. And I think
it's a big field. Everybody can do this.
Everybody
in your
can, that's
own
right.
office, in your own reality, with your own patients. It's not one technique that is only mine,
That's
only
right.
for physios.
Yeah.
You're not allowed to do it.
That's right.
No, because everybody assess those
That's
patients, and there's lots and lots of patients that need this kind of treatment.
Speaking of that, this is not a cookbook. We're not giving people a recipe and say do A, B, C, D, and do it in this order. We are saying you have to take the entire history of the patient, the history of their factors, perpetuating factors that have sensitized them, be aware of them when you're examining the patient, and educate the patient about what sensitization is and how it can influence their perception of pain. So this is really important.
That's the key for the success of our treatment,
That's right.
I guess.
Yeah.
I guess
Exactly.
And it's so important because it's a drug-free treatment.
Yes.
And these days, people take so many medications, especially people with chronic pain.
Right.
So I think if we can do something that is not pharmacological, it's for the best, right?
Absolutely. Absolutely. If we can do pharmacologic, that's the classic ladder, right, of pain management. You start, pyramid. You start at the basic,
At the
right?
base, yes.
Non-pharmacologic, and then slowly add things instead of going right to the top with the more invasive procedures.
And for the people that they are in the top, you can modulate to go down.
Right. Absolutely. Right.
Yes,
Right. So
and I guess
you can
it's-
help people. Right.
Hopefully, to prevent some chronic pain.
Yes.
Right.
That's exactly right. Great point. Because once people understand what sensitization is and how they get sensitized, they can do things to keep sensitization at bay, such as mindfulness,
Yes.
right? Relaxation.
What do you think
etc.
about this?
I was so impressed.
Can you tell us what happened?
Because we were examining somebody and we started treating them by desensitizing some of their segments, and then we tried doing other treatments to which they were overreacting, meaning they were probably finding it uncomfortable personally, as well as being the subject of everyone watching at the same time.
Yes.
And they became more anxious, and you could see that they were not wanting to complain, but at the same time, their affect said that they're not in a good place.
She really wanted to
Participate.
persist.
She wanted to participate,
persist.
but to the point of self-harm, meaning, sensitization.
It was not
Yeah.
good for
It wasn't good for her, right?
Yes.
So it was such a great idea to have Michelle share her approach and with techniques with the entire class, that everyone could see the benefits of doing.
Yeah, we called
mindfulness.
Michelle.
Yeah.
Bruna was the subject. She wasn't feeling very
Comfortable
comfortable
Right.
with the
Yeah.
things that we were trying and showing on her.
Right.
And then I looked at Michelle. I was like, I think
Now
she
we are
might-
going to use
That's
you,
right,
her
we're going to
knowledge.
use
And
her
I just went over there and said,
Yeah.
Michelle, can you guide a meditation? She said,
Yeah.
yes,
Of
sure,
course.
of course, just like that.
Yeah.
And she did, and it was very nice because everybody did it together. and
we
felt.
Yeah.
Jay said, "I cannot move from my chair. I'm
Yeah, I just
so
want to sit here. I'm so
here.
comfortable. I'm feeling very centered.
I just
This
want
is
to
it. I'm
be
here.
here." And the point is that just
Yeah.
be here.
Yeah,
And
be
feel
present in the
present.
moment, as we say. Right. No, it was amazing. Great experience.
And it wasn't programmed.
Oh, it was spontaneous.
No, it's
It was
spontaneous.
completely
It was
spontaneous,
spontaneous,
right?
yes.
But this is how you have to deal with chronic pain in your clinic. You have to deal with the patient in front
We
of you.
have to have this.
You can't just say, I'm going to do this, and
No.
it's some sort of recipe. No, you have to use your clinical judgment.
That's why we say we hate protocols.
Yes.
You need a guideline.
Right,
So
Just
you
to
don't
know
do
where is the north.
right.
We need
Yes.
a guideline just to know where is the north.
Right.
where it should
But,
go.
but in our day, in our routine, you must have to focus on your patient, and then
Yes. In English,
Walk
we
with-
say, meet the patient where they are.
yes,
Yes, that
exactly.
expression, right?
That's the point.
Because if the patient's coming in and we are only considering the musculoskeletal system and they are extremely distressed about something and we don't even ask about it, it's almost like you're just being a technician. You're
Yes.
not being a clinician.
Yes.
You know, that's the difference.
That's
And they
And-
leave frustrated. Sometimes
Right.
they don't believe you anymore, or in that treatment say, "It's not gonna work.
Right.
I'm gonna keep
Yeah.
my pain, and it's not
and
working
for
at all."
us, we in some any time we can feel this emotion. Oh, I can't do nothing. Why?
Why? Yes. Right.
Why?
Yeah.
Sometimes you can. It's not just that thing
No,
that
you have
Yeah.
to adjust your.
Yes,
That's right.
Yes.
Yeah.
Uh-huh.
Yeah, there's that sense of powerlessness. You feel powerless, but that's why you remember the slides I showed where you're starting to restore hope. You giving people the demonstrating to them that they can improve their pain or their range of motion or their quality of life, their daily function, just with small baby steps. You know, one step at a time. So it was a great experience. And you asked me the question about teaching and training, and this is really something that I believe so strongly in, and I enjoy so much. And for me, having met you so many years ago, and of course Jackie more recently, but to see your enthusiasm and your excitement and passion for wanting to teach and educate and see patients, and this is really, it's such an admirable thing, and I'm so happy to be a part of it.
Thank you. You are our inspiration,
Thank
actually.
you.
Yes.
I appreciate that.
Back home at NIH, do you teach medical students?
Yes, we have medical students who come sometimes rotate. But more than medical students, we have residents.
And
Yeah, residents
do
from
they-
National Rehab Hospital. We have one hospital which we have a contract, which means their residents
come.
in physical medicine come.
And do
train.
you show them?
Yeah, of course.
And how do they take it?
They take it very well because they're still in training. So their minds are not yet, like you said,
Closed.
some people closed. Like, I think everything I've learned is right here. I don't need to do anything else. That's being closed-minded. That's ridiculous. So no, they're very, very amenable to new information and learning
And then
Yeah.
put in practice?
Yeah, of course, absolutely. Yeah, I hear stories from students, from residents. Students we only get very occasionally because NIH does not have a residency program. So medical students typically go for rotations, elective rotations, in hospitals where they would like to eventually apply for residency. We don't have a residency program. So but we once in a while have a better, but it's very rare, just so you know. Yeah.
And could you tell for us and for them your history with myofascial pain?
Yeah.
When you started to study this?
Study it, right? Yeah.
What happened to you?
Yeah, so it was very
We know,
interesting.
but they
You
don't.
know, it was very interesting. So, being a physiatrist, the musculoskeletal system is the big part of what we see and treat every day in the clinic, right? I was already interested in it, but I certainly knew about myofascial pain, but I would not tell you that I was at all experienced or trained in assessing it. it was only after I sustained an injury working on a Nordic track machine, which is the one where you do the skiing motion on the machine. So this was way back in 1997, and I ended up, as a result of doing that, I felt some discomfort in my ankle, but I ended up tearing the tendon, the peroneus brevis tendon, longitudinally. So I looked up what could be done for that, because at the time I was also a jogger. I used to do very active, and so it said they could do surgery and essentially sew the tendon up. So I spoke to a specialist. He said, yeah, we do this all the time. So I thought, okay, I'll have the surgery. I'll be non-weight bearing for 2 weeks in a cast for 6 weeks. And then 6 weeks after I came out of the cast, my leg was like a frozen piece of wood because the tissues had all contracted and bound down in my lower leg and my ankle. And as a result, when I was starting to walk, it affected my gait. So I first started developing pain on the sole of my left foot, and then eventually my right foot. And this had the quality of neuropathic pain, because even like light touch was very, very painful. But there was no nerve that was cut or injured.
And you felt both?
Eventually both sides.
Wow.
And imagine, here I am, I'm a new father. At the time I have a child who is 2, and then actually 1 on the way. So our youngest, 1998. And this went on for a good 5 years. And I was, quite having a lot of pain, quite disabled, and also getting very depressed, because I was going to see every pain specialist there was, orthopedist, neurologist, anesthesiologist. I did go to see people who were trained in myofascial pain, but I did not respond to any local treatments, including the gastroc soleus. And believe it or not, I had injections and needling in my intrinsic foot muscles, which is not very pleasant sensation. And not only that, but I needled my own intrinsic foot muscles.
You did?
Yes, because I thought I can feel it, there's something there, and I tried, but nothing worked.
It was neuropathic.
It wasn't technically neuropathic because there was no nerve lesion, but it was sensitized. I had sensitized. So this is what is so remarkable, is to tell the whole story. So I was starting to read about Dr. Fisher's work, and also there's a medical doctor who's an acupuncturist in Canada, and I was corresponding with him, and I said, I'm currently in Bangalore, India, and I sent him my symptoms, and I told him what happened. Well, he said, oh, you need to have a segmental block done. And I said, well, no one has recommended that to me before. So he explained what it was in acupuncture terms. And then I looked at it and said, oh, this is the medial branch of the posterior primary rami. He said, yes, that's right. So imagine, I'm in India. My brother-in-law is an anesthesiologist. He was also on vacation. So I said to him, this is what he's recommending. Can you do this? I said, of course. He said, of course I can do it. And I showed him. So he did an injection. He did an L5-S1 block. And all of a sudden, it's like this. Like
no
it
way.
was, if it doesn't, you don't believe it unless it happens to you, right? So I needed one treatment and then one more, and then that was it.
That was it.
That was it. It was gone. And between the feeling of joy, of course, now that all of a sudden, yes, I can be physically active. Yes, I can play with my children who are now, toddlers, but growing older. Otherwise, I couldn't even walk with them, forget running, But then I became angry. I became angry at the medical profession that completely dismissed my symptoms, kind of almost made me feel like I was a complainer. And I thought to myself, I'm a medical doctor, and not that I deserve to be treated any differently, but if this is how they are treating a medical professional colleague, can you imagine how they might be treating layperson, the public, who has no knowledge whatsoever?
Yes.
So from that point on, I was laser focused on understanding central sensitization, myofascial dysfunction, and of course the connection between the two.
Yes.
But also realizing, because even for the people who were the myofascial pain experts. They kept wanting to do injections in my gastrocsoleus, and I kept telling them it's not working. But they kept doing it again because to them it was clear that they press here, that this is a trigger point, it refers pain. But I said that's not working. And in fact, that's why I told both of you yesterday when you were doing the treatment, I have a paradoxical reaction. I actually get worse with needling. I've needled myself, years ago, at least 20 times, thinking it might come differently, but it never did.
And how are you feeling today?
Fine. I'm feeling very well. No. So I do have some baseline sensitization, but I think it's probably also related to just the fact that I'm getting older. I have some degenerative changes.
Yeah, but after what we did yesterday with you, are you feeling any?
No, I wasn't having any pain yesterday. I wasn't having any pain before that. I was just curious to see what you found in the tissues and what you could do with that, And we didn't have time to do it, but I wanted to have you assess me for sensitization pre and post treatment. I wanted to see if you could.
Have time.
We didn't have time. That's all. Yeah.
You can come more, or we can go over there as well.
Yeah, that's right. Yeah.
Just invite us.
Yeah, exactly.
Actually, I'm gonna do the same thing you did with us.
Yeah.
I'm gonna buy my ticket.
Yes.
I'm letting you know I'm going. Right. He just did that to us. I'm buying my ticket. I'm flying.
Well, I think Bia and Jackie, maybe this is the moment to discuss what you were deciding to create and how you started to share that with me. And I think, again, I was all in the sense, I was all in telling you, go do it, let's do it.
Yes.
And I was trying to say, whatever I can do to help, I will help you. So first we did the interview, right? And then it gave me a good sense of what you were trying to accomplish. And you said that the course was very successful. And of course, that first course, you had a smaller group. It was in your clinic with physios only. And then, like you said, for the next version, I gave you 2 sets of dates. And then accidentally you chose one that I think that's when I was going to Spain. I said, no, I cannot come the 1st and 2nd, but I can come, the 14th through the 16th. Yeah. So you two, in your wonderful way, flexible way, you were able to pivot and rearrange your schedules so that we could make this weekend happen. And again, for me, it's like there was never a doubt about how well it would go. It was just more of my desire to do the best I could do to help, to make it a wonderful experience for you. Wonderful experience for you, both of you. That was my goal.
And for the students too.
And for the students,
Yes.
yeah. But for you, meaning what I'm saying is you two are the course organizers. It's your baby.
Yes, it's
And
our baby.
you're still, I don't know if the baby has been born yet or it's still it's in pregnancy, but you know what I'm saying. It's going through its month.
I told you yesterday, we started from 0.
Yes, I know.
And we did it
I know.
all together.
It's
Only
remarkable.
we two.
Absolutely. It's
It
unbelievable.
was a hard work, but I guess.
Exactly.
Worth it.
And can you imagine if this is your second course where everything is like, we have an expression, that you have to make sure the trains run on time. You had all the trains running on time, everything that's going on, and at the same time trying to manage everyone in the group in terms of their own interests, their
this is challenging.
This is very challenging, especially multidisciplinary.
Make it special being multidisciplinary, but it's also very challenging for us because, for example, chiropractors. I don't speak with them. I didn't have any experience with them.
Yeah. See, I do. I have quite a lot.
You do.
So I think that made it really easy. And I already messaged John. I told him, I said, the fact that we had so many MDs and so many chiropractors and physios, it just made for, in English we say, enriching experience for everybody.
But for us, was like a wall.
Because of
And now
lack.
we dropped it.
But then how did the chiropractors even come? How would they?
Felipe was my friend, and we trained in the same gym. And someday he was passing through me. I was like, Felipe, Jay is coming. He, what?
Yeah.
Jay is coming. I'm going.
Oh, because Felipe had come to my course before.
Yes.
Yes.
See, that's
Yes.
I'm
a-
coming, and
then-
I'm taking a lot of people with
good.
me.
And look at Fernando. Fernando, his eyes were open. He was
Yes.
like,
He was very
he
excited.
was so
He was
excited.
very
And I
excited.
think what it also tells me is this, because I got the impression from what Fernando said. He said that in Brazil, unlike the United States, people are not thinking about chiropractic treatment as much. See, in the United States, many
First
times
line.
chiropractors are the first line.
Yes.
You know, because they have done lots and lots of promotion. People are familiar. They don't want drugs. And if you find a good chiropractor, you know, it's worth gold because they can help you.
Nice.
But I think he understood that I was speaking the science of sensitization and facilitation. And so that's what I'm saying. I think, like to your point, we're breaking down barriers so that we can start to communicate. Because at the end of the day, you have a patient in front of you.
Yes.
You know,
Yes.
whatever your specialty is, how are you going to help this person?
Yes,
You
absolutely.
know,
And
yeah,
that's
knowledge.
exactly what I tell
Yeah.
the students every day. I say, stop only moving the patient forward. Like, oh, this is not my area.
Yeah.
Just go find someone who had. No,
right.
take it to
Take
yourself.
it on.
And do
Discuss
something.
with your
that's
colleague.
right. Curiosity.
Discuss
Yeah.
with
Be,
your
be
colleague.
brave
Absolutely.
to do something, not just.
Absolutely. And in fact, that's why what you said about if therapists are closed-minded, it's almost like they have no idea what they're missing. It's almost like you could open a door and enter a paradise of knowledge, things that would give your career such a sense of promise and excitement. Instead of thinking of this as a job, it's more of a, you know, it's a career. It gives you tremendous satisfaction because, you know, we do this because we want to help patients, right?
Yes,
That's
yes.
why we do it.
Yes.
And so that's why the group here, you saw the light bulbs going off and you saw people, family medicine, internal medicine, palliative care, orthopedics, anesthesiology. They're saying, oh, how do we teach our colleagues? How do we do this? Yesterday we met Fabiola, anesthesiologist, Lucy Franca, who has invited us now to teach with the course that we're doing in Curitiba in March, and also one in Sao Paulo. So, you know, slowly, I hope that we can continue to, you know, just bring people in. I'm at the stage of life where, you know, in my career, I don't worry about people who are negative. Just leave them by,
Yes.
and bring people who want to come.
Yes.
You know,
I guess it's easier.
It's easier, right?
It's easier to work
We-
You
like
have a
this.
point.
We have
You
an
a
expression that came from a movie, right?
Hmm?
If you build it, he will come. Meaning,
Yes.
if you build something, they will come. If you build something of value and of durability, of application to human, to medical care, people will come because they will see how much benefit is gained from it, either from their own bodies or because they've learned
the patient.
from patients, but then also they've learned from their colleagues.
Mm-hmm.
Oh, just like you said with Felipe. Now Bruna and other people say, oh, you have to go see the course that
Mm-hmm.
Bia, Jackie, and Jay are teaching, you know? So slowly, I think, you know, you're going to
Hopefully.
continue growing.
That's
yeah.
our mission.
Yeah.
Our
Yeah.
mission.
Yeah. So one of the things that I brought, because as I told you in one of our phone calls, Dr. David Simons had given me this book way back in 2006, and I'm trying to remember the context. I remembered vaguely. He knew that I was traveling to Brazil, that I was going, because he wrote a note in the book where he mentioned that, you know, that Brazil is 1/2 of South America, and it's the population of the United States, and, you know, there's lots and lots of clinicians and practitioners. So he had written this, and then as we were having these discussions, I said, you know, I really want to gift this book to both of you because it's in Portuguese, which I think will help you, not that you already know a lot of it, but it'll help you to teach others, right? Sure. Imagine now that you have this book in your library.
Wow.
You've learned it in English,
Yes.
but now to be able to see it in Portuguese,
Portuguese.
would be really, right? I would think very, very helpful to you, right?
Thank you very much.
No, it's my pleasure. And I actually,
gosh.
I wrote a long thing, as I said. I wrote something.
Another book.
I wrote a book, yeah. No, I really, I put a lot of thought into it, and I wanted to just share this with you. I even put the date and the city because it's in Sao Paulo. So I'm just going to read this. Sometimes it might be hard to read some of my handwriting, so I'm just going to read. This is sort of my signing of the book, but my message to both of you. As I gave the book to both of you yesterday, dear Bea and Jackie, while I expected you to be happy about receiving this amazing book, I had no idea how overcome you would be with such heartfelt emotion, joy, and disbelief. And I think he recorded that yesterday, at least some of you. It was a truly priceless and unforgettable reaction that I will never forget and I will always treasure. Thank you both from the bottom of my heart for your tremendous enthusiasm, laser-focused determination, and unwavering commitment to advance your learning to optimize patients' lives and impart your tremendous knowledge and clinical expertise to all healthcare practitioners and the next generation of them too. Doctors Travell and Simons would have been so thrilled, impressed, and proud to see you continue their legacy and build upon their work in the clinical, teaching, and research domains. This book of knowledge, wisdom, possibility, observation, and hope is now in the hands of two outstanding, humble, and empathetic people who will use it to help the lives of untold thousands of people in the years to come. The torch has been passed to extremely deserving and worthy people who will use it to help their patients by optimizing treatment protocols, performing clinical studies to test their hypotheses, and by impacting the field of non-pharmacologic management by teaching state-of-the-art educational programs that are interdisciplinary, inclusive, and, as we saw today, I'm ad-libbing here, inspirational too, right? I hope you realize what great movers and shakers you are becoming as manifested by your insatiable quest for knowledge to improve the human condition and by so generously, eagerly, and wholeheartedly sharing your acquired knowledge with everyone who attends your courses. Imagine, in 2007, Dr. Simons told a gathering of physios and physicians that he was convinced that it was the physios worldwide who would cherish and honor Travell's legacy by embracing, utilizing, and teaching their work. ReMiND is a living testament to their greatest power, empirical observation. In fact, you are the embodiment of this. I am so proud of you and excited to join you on this journey together. The possibilities are limitless, and I envision you taking and growing ReMiND not only all over Brazil, but also exporting it to the rest of South America and the rest of the world.
Wow.
May the tremendous enthusiasm, optimism, vision, and work ethic we share be forever guided and infused by our mutual respect, appreciation, and admiration for Travell and Simons' living legacy to mankind. Your pioneering spirit, courage, resilience, and conviction will serve you well as you embark on this journey. I am overjoyed to see it happen as doors open for you, and I am ecstatic to travel on it with you wherever it leads.
Yes.
Congratulations, with all good wishes, Jay.
Thank you so much.
My pleasure, my pleasure. Thank you. Oh. Yeah, of course. Thank you for doing this. Yeah, thank you. Oh, I appreciate it. Thank you. I know you are. Congratulations.
You always make me cry.
Oh, I'm sorry.
Very much for us to have you here with
Oh, this is sweet.
teaching.
Oh, my pleasure.
It's very good to have you here.
Keep it up. You're doing great.
Thank you.
Absolutely great.
Now we're gonna fight over this. It
No,
goes
it's
to my house or your house.
Okay, you know what? We're gonna rip it in two.
No.
Okay, you
We
get.
can exchange like 1 week.
1 week with you and 1 week with me.
Okay, just
That's
like
right,
when
yeah.
parents separate and take the kids, you take them.
Oh my gosh.
And now we take.
She's gonna say, "Wait a minute, you're supposed to be
Yeah.
on. The book was supposed to be
Deliver.
here at 5:00.
Yes.
Where's the book?"
Yes, where's the book? I want
No,
the book.
but just let's continue because yesterday when I was still lecturing, I saw you looking at it. Just tell the group in Portuguese, what were your first impressions of the book and what did you observe about it in Portuguese so that's easy and you can tell me later. Yeah.
Assim, isso aqui é uma bíblia pra gente. Quem estuda dor miofascial, quem se encontra na dor miofascial, é uma bíblia. Certo? É o ponto de partida, mas também é o ponto de chegada. Né? A gente vai e volta nisso
nele.
aqui. Então, eu nunca tinha visto a edição em português.
A gente,
Amazing. That's amazing
a gente
to me.
estudou na edição em inglês, né?
Porque acabou rápido e eles não fizeram outra. Então, já é lindo de ver um em português. Com o papel do Simons, então, com a letra dele,
Yeah.
com o receituário dele, isso aqui vale ouro, isso aqui é um tesouro. Você pensar, if you had the idea to bring to us, trazer pra gente, já pensando em nos surpreender e nos presentear, já
isso
é
foi
incrível. E ainda por cima, escrever tudo isso que você escreveu from the bottom of your heart, because we know that you really meant every word, and you put a lot of effort on writing this.
Yeah.
Started back when you first emailed us and told us about this.
Yes.
Remember that I said
cried
I'm
that
gonna
first time.
Yeah, we
Yes,
cried.
yes. I told you, yes. I didn't use the same words because in that email, what I said is, at that moment, he knew his life's work would continue.
Yes.
It was even more emotional than this, but I didn't want to
No.
repeat it.
No.
But at the time, he was in the twilight of his life. And imagine if this is your baby, and now, you know, and you don't want it to die. So he was just so happy and proud that it was physios that were continuing to build it. So now I'm getting emotional.
Can you
about
imagine?
that, yeah.
Can you imagine
Yeah.
how big is our responsibility to have this from you?
That came from him.
That came from him, yeah. No, that's
It's a treasure.
It's
It's symbolic.
Yeah.
It is symbolic,
Yeah,
but
I
has
think
such
of
a
it that way.
value.
You're right.
This
It's really
big.
a treasure. Obviously, I'm going to study from that, but
Yeah.
I don't want anybody to touch this.
Yes, me too.
Ninguém pode encostar
You
nisso
don't want
aqui,
you don't want
certo?
anybody
Só
touch it.
nosso.
You don't want anybody touch it, including Jackie. And she doesn't want anybody touch it,
On
including
her
you.
days, she can touch. On my days, she cannot touch.
That's right. No, but you know, again, what I forgot to mention is that, of course, that
More surprises.
No
My
surprise,
heart.
no surprise.
My
you know,
heart.
You brought me. Where is it here? Yeah, you brought me my own shirt, but unfortunately, it's too tight. But I did want to show the camera that yes, you were thinking about me
Here.
as part of the team,
Every
right?
day, every
So
day.
yeah, so I am part of the team, and you know, we're going to do really great things together. So
I have to confess something.
yeah.
Last time that we saw each other on
In
Congress
May.
in
In
May,
May, yeah, very recent.
those how do you say that you just said
Light bulbs.
light bulbs
Light bulbs,
happened
yes.
with us,
Yeah.
and we went away like
Yeah.
have to do something about this.
Right.
But we were when we first got in touch with you by email, telling you about our project,
Yeah.
was like for asking for permission.
Really?
Yes.
I wouldn't
Yes.
even think of it that way. Honestly.
Yeah,
I don't
even legally, because it's your work, it's your job that inspired us, and we were asking for permission.
Well,
we could
that-
never
Imagine
imagine
that you
Yeah.
will
come together.
Yeah, well, that's interesting you say that because this is exactly what I do. I mean, I've been doing it so often, but see, to me, that's also a sign of it's an indication of the type of people you are. You know, like you were saying, your value system.
Yes.
You know, the values that you have, and that
We
that
share
is-
the same
That
values.
is enormously considerate and respectful.
Sure.
But it's unnecessary, you know, because you know we are teaching this together. It's something that we want to continue to advance. And so that's why I'm so glad that you did reach out to me, that you didn't hesitate, because maybe you also, just because we knew each other so long, I mean, off and on, I mean, at these meetings, and don't forget, we also had, what I think that what made the difference, you talk about how this went from Simon's to me to you. What I think about now is, look at what happened here. Felipe came and he brought his chiropractors. Why? Because he was at the course in May.
Yeah.
The course in May was organized by Lucy. She made it so that I had an entire day. Giving me an entire day inspired the two of you to say, maybe this is something we can also try to teach, and et cetera, et cetera. So it becomes like it has its own momentum.
It's a net.
It's a net. It's in English we say it organically develops.
Yes.
This is what I think is so powerful about sincere collaboration and ability to kind of work together when what's most important for us is the product, which is the course. That's why I wanted to be, I wanted to have my slides, in sync with yours. I wanted them to see that we are a team. We're a team, yeah. Starting from now. That's why, don't. I appreciate what you said, but it's unnecessary. But I appreciate that.
That is really true. It's really true. I'm being honest with you, right?
Yes.
We were like, we have to talk to Jay because we had this idea.
Yes.
Right.
That we must have the permission.
The permission.
Yes, but we couldn't imagine that you were going to be here with us, teaching
Side by side, because we are under like kilometers.
Yeah, but you're at a different phase. That's all. I mean, it's that we're all clinicians, and I keep trying to tell both of you guys, when I watch you teach, it's so obvious that you enjoy it, that you have mastery of the subject, familiarity with it. You can take questions and then you can give information that is, meaningful to the person who asked the question. If you don't know, you say, I don't know, and then you'll try to get the answers, So you look at the reactions of everyone in the room, the physicians, the therapists, the chiropractors, everybody was kind of, congregating around both of you and Amia's just to get more information, etc. So it was a tremendous success. And it bodes well for the future, which we need to discuss when this is over.
Yes, we're gonna do this. Obviously.
Okay. Yeah.
Thank you so
We
much.
would like to thank you
Oh,
very much.
My pleasure. Thank you. And thanks to both of you for coming and helping organize all this. I mean, really appreciate it. Thank you so much. Okay, great.
It's mine.
That's fine.
Take it.
Let me see.
So what? One thing you should do first is make sure you put another tape on
Tape,
here.
okay.
It could come out. It's not going to put that, but
Sure.
Yeah. But you're right. It's so nice that, and he actually stayed in our home. He spent one night. And I think that's when he gave it to me, and he must have just had it with him. And I must have said I'm going to Brazil, so it might have just been a very cool. Because there's no way. Because I don't, he wouldn't bring the book to me. He must have had it with him. And I mentioned Brazil, and he gave it to me, and now you have it. 20 years later. That's serendipity. That's serendipity.
Serendipity. Yes.
That's serendipity.
Serendipity.
Yes.
I love this.
Finish.
And somewhere David Simons knows that this is happening. If
think so?
All I'm saying is that when you see people's reactions, your reaction, my reaction to your reaction, my reaction to remembering what he did when he told us the story about his life's work, it's powerful. I mean, there are things we don't know about in the universe, right? We don't know. I'm just saying, for me, to me, I feel like Simons and Travell are smiling down on us. That's all I'm saying, because we are continuing their legacy. We are doing that right now in real time. So this is great.
And who are we going to pass that through? Because we're going to keep passing.
You have a long way to go to decide that.
Yes. In 30 years, we're going to pass for somebody.
Exactly, yeah. That's great.
Thank you very much.
Okay, thank you.
Thank you.
Thank you. This is great.